Welcome to Public Health Musings with Dr. Caroline Kingori, where we explore the pressing issues in public health today. In this episode, we're shedding light on a critical topic, HIV prevention in the Black community, particularly heterosexual women. I'm thrilled to have Grazelle Howard from the Black AIDS Institute with us. She'll share her insights on the barriers Black women face in accessing prevention tools like pre-exposure prophylaxis and the innovative strategies that the Institute is using to empower and educate. Join me in welcoming Grazelle to the show. But first, this episode is sponsored by Opera Coffee. Elevate your coffee experience today with premium freshly roasted beans delivered to your door. Use code SAVE10 for your first order or SAVE16 for any 3 products at checkout. Treat yourself at shopukiraracoffee.com. Now let's dive in and learn more about how we can all participate in ending the HIV epidemic. So glad to have you on the show, Grazelle. So excited. Yes.
I am elated to be here. Thank you for the invitation, and thank you for the work that you do.
Thank you, and thank you for the work that you do. So let's kick things off. Tell us a little bit about yourself and your journey to this point.
I am a native New Yorker, and I live in Charlotte, North Carolina. So what I share with people is I'm a third-generation Northerner, which is unique for African American people, and had the privilege to grow up in the South. So I think I am a face of what we would call the New South. However, a citizen of the world. As I say, growing up in New York, I have always been surrounded by healthcare. My mom was a healthcare pioneer, and in her words, she did everything in healthcare but operate. So that's all of the support services and innovations around patient care and patient-centered wellness. And one of the things we really are proud about her, she was one of the first people to get McDonald's to actually modify their menu. And this was back in the 80s because they wanted to have a kiosk on a hospital campus. And so she was able to get them to make more healthier choices in order to have this kiosk. And that's just one thing about Rita Howard. But I grew up in healthcare, and I'm a healthcare advocate, and have been a healthcare advocate since really even almost pre-college, like in the 70s, in 79, 80. And it was then just really about reproductive health and women's rights. And so if in fact we just talk about reproductive health, women's rights, and infant mortality, then we are at the cornerstone of everything. It transcends race, it transcends class, and it transcends countries. So doing reproductive health and having some amazing mentors, Dr. Yvonne Maddox at NIH and Jewel Jackson McCabe, Beverly Guy Sheftall, Stuart Spellman, I kind of had the courage to say, well, if it is in fact women's reproductive health, then we started looking at oncology, specifically breast cancer. And in breast cancer, I discovered that clinical trials lacked Black women. But initially, the first clinical trials lacked women for certain cancers, period, and cardiac disease. So we weren't having good outcomes as women. And then when you shave that down, then Black women certainly were not having good outcomes. And that was really at a time when the National Coalition of 100 Black Women and the women of the NAACP and women of Alpha Kappa Alpha, women of Delta Sigma Theta were focused on healthy women. So we started down a path to see if we could create a public-private partnership, and it was around sudden infant death mortality. And the National Coalition of 100 Black Women led that. And then from there, we said, well, sudden infant death mortality, now we must also focus on the moms. And that's how we got into STIs and HIV. And the founder of the Black AIDS Institute invited me, and I selected 2 other women from the coalition, my mom and another woman, and we went for a meeting of HIV leadership, addressing how the current HIV leadership could impact, for lack of a better word, mainstream Black America. So if you remember the advent of HIV, Black communities got the wrong message. It was a gay disease, Haitian people, drug addicts, prostitutes. And I think today some of that misinformation is still seminal and how we are still so challenged and most disease burdened. And we were discussing before we went live that you're from the continent and I am a child of the diaspora. I submit to you, on the continent, HIV doesn't have the same stigmas as it has in the diaspora. So there's still an opportunity for some real Pan-African work. And only women can do it. And so this is how I landed in HIV. In the early 2000s, when you realize that we have been faced with a virus that impacts everything that we are: love, procreation, great sex, hopefully we all get it. There was nothing else more relevant for me as a volunteer. So I entered the sphere of HIV purely as a volunteer. And most of my time in this HIV journey has been as a volunteer, purely. And then when I say a volunteer, I mean literally supporting all the amazing people who have done the work. And we could list them on and on and on. And in 2000, I guess in one, the board of the Black AIDS Institute decided to make leadership changes. So we all are all hands on now in a whole nother way. And so perverse, you see me today, I'm talking to you in Charlotte, North Carolina, from our newest satellite location. We're founded in LA, and now we have a space and an office and a presence in the South. In the South, in an interesting space. The Charlotte, North Carolina is known, as the jewel, right, or the Queen City. Yet we are seated in the epicenter of the epidemic in the state of North Carolina, and with some of the highest STI and HIV reporting new cases and existing cases in the Southeast. So thank you on behalf of the persons who are thriving with HIV, for those of us who are in the trenches attempting to revolutionize how we prevent and care for Black people with HIV.
Thank you for such an amazing introduction, taking us from the 80s up until now. And I want to hone in on Black women because we know all the disparities surrounding this particular demographic group. And so can you give us a sense of what this landscape, you've told us in the South that, there's obviously an increase in new HIV and STI cases. So for HIV prevention in the Black community, especially heterosexual women, what does that look like now?
Thank you for prefacing it with, let's turn specifically to Black women. And maybe I left that out in sharing my journey as you asked me. In that meeting, I realized that heterosexual Black women were not represented as a segment. There were brilliant heterosexual Black women in the room. However, Black women were not engaged in the advocacy or in the information in the 80s, in the 90s, and the early 2000s. And if we look at everything Black, you must start culturally. What is the cornerstone of the Black community? The Black woman. Black woman is the moral majority for the planet. We have been the wet nurse for the planet. Look at our history. And we are constantly neglected in the public health model. And HIV is no different. If we go to San Francisco and speak about who's the first person to pass, who's the first person that died of HIV, it actually was a Haitian woman. No one can speak her name. If we talk about all the cases in New York, women were being told that their husbands died of pneumonia, but they were not informed. It's very, very late, even in the PrEP conversation today, that we have been neglected. So the role of Black women is to recenter ourselves in the center of our community as the hub, inform ourselves about HIV, the facts, the myths, the biomedical interventions. And once those biomedical interventions, facts, and myths are understood, Now apply our cultural fluency. If we literally had a model that did that, the cultural fluency layer would then allow for us, intra-racially, to sterilize stigma, dismantle stigma. In your home, my home, village, town, city, whatever you want to call it, hood, hamlet, Big Mama determines. That would then include bringing in the faith based community in appropriate ways. We have so many opportunities to influence and almost right at this point demand that women lead in the plight of HIV. Because as of the election, it is more important for us to focus on the needs of Black people in an inclusive way, not to leave out anyone, but to be very specific about the needs of our communities. And I am speaking Black now, not just Black Americans. I'm speaking about Black immigrants. So that's Africans, Haitians, Jamaicans, Trinidadians. And we don't have those conversations often. So if we take that approach and inform Black women in her communities, whether she's 8 years old or 88, now we can track a true trajectory. If we just come straight down to HIV, Black women are greatly impacted by HIV, and in the South, in an overwhelming way. And in the South, we still have an opportunity to just purely educate, right? We know the latest brand of toothpaste. We know the latest fashion. We know the latest fragrances, the latest music. However, we are not current in HIV today as Black women. We're not current in the status. We're not current in the risk. We're not current in the treatment. And we, quite frankly, are not current in the role we must play to help our young MSM, young men who have sex with men, our transgender sisters, the transgender male. The young people are demanding that we look at how they see themselves. So I'm going to even go as far as say the GNC, the non-binary. And then let's not forget that the biomedical interventions have been so great that we now have an entire population of folks who are thriving and aging with HIV. So some persons actually have grandparents, aunts and uncles, and great aunts and uncles who are thriving with HIV. That's a conversation we never speak about. Here in Charlotte, we're proud that our church, community, development corporation built one of our first really focused senior centers for the aging. We talk about affordable housing, but in Charlotte, we have an affordable housing for seniors. What does that mean? That means we have an opportunity to go to a senior living facility, beautiful, and educate the seniors about HIV as well. When I entered this space, Big Mama was contracting HIV at a rapid rate. We still have that. Just because you have an AARP card or a hysterectomy doesn't mean you cannot contract HIV. And COVID ushered in something really amazing, a lot of divorce. So we have places that we go that are exclusively ours, where we can use those as the depots and the hubs to inform ourselves, not just about our beauty and our money and our men, but our health. And that is if we can get Black women to see that that's the role we play and just weave HIV into that, I believe we would see a bend in the trajectory, not only for Black women, but for our community, right? This is the only statistic I'd really like to talk about because I think it frames it up differently. Our white sisters can have sex with, you ready? 100 men before she is exposed to HIV. Depending on your zip code, ours could be 1 in 15 or 1 in 33. What? Really?
That's crazy.
We have the Crown Act. We had to fight to wear our hair. And we still have an unevenness in our loving and in our passion. And if we speak truth to ourselves right now, we're focused on the lack and the limitations rather than being in our role. And what is the role of a Black woman? Regardless of your education or your economic status, we have always been the elegant truth sayers and carriers of life in the water. And so if we bring those core skills back to HIV, I still wake up every morning believing that we can bend the trajectory and have, you know, where people are not currently contracting something that is preventable. This is the country that celebrated, zero prenatal HIV. And now we're on the trajectory again back up.
So unfortunate. So much you've said in that. I'm looking at the multifacetedness of HIV itself, and then the intersectionality that you brought in this conversation. And then those statistics, 1 in 100 and 1 in 15, 1 in 33, based on your zip code. I definitely can relate. I used to live in Baltimore, and we did some work out there. And we had those zip codes that had the highest, cases. And, we had this project from the CDC. We went and talked to the barbershops and, the salons, and we even went to the strip clubs to try and ask them, to intervene 5 minutes to talk to their clients. The strip clubs told us no. But the grocery store said yes, and all these other establishments said yes, and we had this great partnership with them. And and this was like in 2008, and we're still having these discussions today. So looking at all of that, and the disparities that we have, the socioeconomic factors that affect Black women, also literacy levels, right? The stigma that you talked about. There's so much. Where do we start again,
And literacy, let's be clear, literacy in can you read or literacy in do you know,
Mm-hmm.
right?
Mm-hmm.
And so today, certainly when I was most impacted by understanding the high literacy rates we still have, it was when President Obama ran for president. And that's where it was kind of glaring because we had beautiful Black men and women, and I will say more men, who could not read, but they were there to vote. So, I just want to separate literacy from actually reading to literacy about our health and literacy specifically about HIV. Right? Reading is fundamental and important. However, you can understand HIV very simply. And if you understand it simply and you commit to self care, which really translates to self love, you can prevent HIV. Our struggle and our challenges in the messaging and decoding the messaging. And the decoding, I say specifically because HIV today has taken on segments, or, if somebody says, pick your team, and when you pick your team, then it's kind of where you are. We are not addressing HIV in a holistic way in the Black community. And I believe if we don't, and BAI is kind of shifted to this, right? And we have collected data. So it's evidence-based. We see that we have tried it for 40 years in one way. And we are not having the outcomes that our peer groups are having, or that the majority culture is having. Let's be very clear. If we start breaking it down to cohorts, a young white MSM to young Black MSM, and back and forth, right? What we see is something that is troubling. We have access, meaning we have biomedical inventions and interventions. We have commercials every day. Let's come back to the commercials. We have great organizations and pharma pushing out the messaging. So for young Black MSM, why are they not retained in care? Or why do they not use PrEP? Your lifestyle in most cases, if you're in an inner city especially, you've heard about it. Yes, there's some hamlets and some rural areas where we actually go and we have partners who go. There are still young MSM who are not aware of PrEP. So I am not saying it's a zero-sum game. However, if we look at the investment that the country has made, it has been male-dominated. Clinical trials didn't have women in them. Some of our first pre-prophylactic drugs were not even licensed by the FDA for women. So the story continues. You see that if there's a continuum. So I would say, and this is not our theme, but I use this because it is an anonymous proverb, but we always hear it takes a village. But also there's an anonymous African proverb that says, when the music changes, so does the dance. And we must change the music because the dance has to change. And the dance has to change to include all Black persons, and Black women must become part of the dialogue, part of the preventions, part of the outreach, regardless if the outreach is for MSM, regardless if it's for transgender, regardless if it's for young non-binaries, or if it is in fact how we age with HIV, thrive with HIV, and we care for our elders. Now, I will close answering this part of the question by saying, let's turn to the commercials.
Mode. Wow, Grazelle, this is such rich information that often we don't see out there, and especially those advertisements that you've alluded to. There's very little that we get from them that could help in spreading this HIV prevention information. But I wanted to go back a little bit, and you alluded to culture when you first started the introduction and what led you to this path. And cultural views is something that I also hold highly, and those perceptions that people have determine how they behave or how they take on information. So how do you think cultural views and stigma around HIV affect how Black women feel about seeking out prevention? And as you're talking about that, tell us more about pre-exposure prophylaxis for my listeners who don't know what that is, so that we understand that biochemical intervention as well.
Absolutely. Culturally, as we touched on, and I say this often, and people are like, how could you put the burden on us? It's not a burden. The messenger matters. And the fluency in culture and understanding will then determine the right message for the right person. And in America, Black women are told there's a list of things we don't do. We don't talk about sex. We don't speak about sex. We don't speak about our sexuality. We don't speak about eroticism. Right? And we don't speak about healthy sexual consent. So everything I just listed, I hope, is a positive. Now, if you turn to Black feminism, did I say that word? That's a place you could go and find at least the conversations and the scholarship and the debate. And that has been occurring from the beginning of time, yet it is not highlighted necessarily in community. It's not referenced in the Black church. It is not referenced really in our social clubs, except for now we may sip and paint, girl, have some wine, or we may have the conversation at one of those wild little sex parties, and okay. But are we having the true conversations? As Gail Wyatt said, Black women must, we must emancipate ourselves from the conspiracy of silence. And that conspiracy of silence could be on intimate partner violence. It could be on drug use, alcoholism, many things. So culturally, we are battling something that's ingrained. Now, On the continent, there's some rites of passage and things that actually usher in more of the conversation, even if in many places it may be draconian or associated with religion. And so it has some things that we may disagree on culturally, fair, but at least it is ushered in. In America, in these yet United States, Black women are still struggling with how we have a conversation about our womanness. Two, because HIV in America, in Black America, received mixed messaging initially, and because, let's just call it, HIV was scary. HIV was a mystery. HIV was like the worst horror movie you could ever imagine. For science and for us as the community, the population. And then let's go to the specific population. Yet, United States, you Black, you understand your plight and your task, I hope. Now you're born in the United States, you understand your task as a Black person, and now you layer on the nuance or the fact that you are gay. Today we would say LGBTQ+++. Sometimes just to be short and abridged, we say queer. Some people don't like that. We say same gender loving. We have a lot of options, but today we speak openly and freely about people because they're free to love who they like, how they like, when they like. The issue is for Black women, we must encourage people to do that safely. And we have not actually been steeped in the game in a way that it would allow us to create a model for our community. So the public health model, as we know it, and the medical advancements as we know it exists. So now layer the Blackness. Who is the number one group of persons impacted by HIV? Same gender loving men, gay men. Who is most impacted in our community? Black men. So we have amazing Black leaders in HIV. And we now know the largest group contracting the virus are our young Black men. In 2004, I saw a film and was in a conversation where they said 8 was too late. 8 years old to speak about sex was too late. That's middle school. What didn't we have then? We didn't have the internet the way we have it today. We did not have social media the way we have it today. We did not have performance-enhancing drugs. Oh, shall I call them Viagra, Cialis? We didn't have them. So the game has changed. But the music has it. So the music is still focused on what? Men who have sex with men. The model has been really focused based on the majority culture. Now, there's been great work to be influential and change the model to address the young Black MSM and Black gay men, period, as a cohort. However, women have still been kind of the sidecar. If you ask most Black women, are they aware of a pre-prophylactic or post-prophylactic? We never talk about that. They don't know what that is. So early in the advent of the biomedical invention of PrEP, the Black AIDS Institute had an entire initiative for Black women and PrEP. And what did we do? We asked women to assess themselves. Were they at risk? Now, here's where the challenge, I think, came in. HIV is so stigmatized in this country that it also inadvertently has become incestuous in its messaging, incestuous in its programming, incestuous in its outputs versus outcomes. So if you look at HIV as a business sector, and the business of the sector is wellness and prevention, we have not created a model that can give the high impact that we need for our community, and the funding hasn't come in that way. So let's start. What is PrEP? In laywoman's terms, if you know your status and your status is negative, and you know you engage in high risk activity, now who defines high risk? Girl, I'm on the stroll. I'm making my money. I sell my body. Am I at risk? Absolutely. Do I use intravenous drugs? Or, no, I don't get high, but my baby daddy get high. You're at risk. I go every other week, girl, to the block to see my man. He's coming out in 6 months. Ooh, I can't wait. We're going to have a party, a private party and a public party. You're at risk. I live in an 18,000 square foot mansion. I have 2 PhDs. He has 2 PhDs and an MD and a JD. We are super bad, baby. But Big Daddy only come home once a month. You at risk. He married me. I know he go over there every Wednesday night. She can. I don't care. She can. I don't care. Because he bring it all back home to me. You're at risk. Girl, I'm living the best life. And this Negro come home and said he'd have made a baby outside. You've been at risk. Speak true to yourself. That's the first risk. Now, if we start talking about it like that, we may get somewhere. The people who really, when we started, well, when I started in this, I applaud Maxine Waters because she spoke about it like that. There was a doctor, and she said something at Howard University, and I will never forget it. We had 1,000 women in the room because the Black AIDS Institute, along with Cheryl Cooper of the National Council of Negro Women and the National Coalition of 100 Black Women, I had the privilege to be the architect of the first women's conference on HIV. It's called Sisters Get Real. They're women like you and I, educated women, middle-class women, women who thought they certainly couldn't touch us, right? And we said, let's get real about it. And the main area you could enter that in was around man sharing. How many married women in the room, husbands had made babies outside the marriage? Right? So HIV doesn't discriminate. And it doesn't discriminate on class or who goes to church. So we must first understand who is at risk, right? Once you understand the risk factors, they're fluids, bodily fluids, IV drug use, unprotected sex, right? Now, this professor said something. She said, if you cannot unscrew that penis and put it in your front pocket, you don't know where it is. Now, you can say, come on, Grazelle, that's real. She said it. I believed it. It impacted me in such a way personally that I can look at you and tell you, I don't remember the date. I don't remember any longer. I've been in it too long, I guess, that I've had unprotected sex. So what does that mean? That just means that hopefully I love myself enough to ensure that I have great sex when I want, how I want, safely. I think that is the message that if we could really get people to accept that message, it would just kind of pull back the crusty layer on an onion. Now we have the shiny part. Now the shiny part gets more intense. Why? You go to church, you listen in your family. Well, now you're gay in America. And you're called names. Not by others, but from the house. From the house. Your daddy or your mother. Antonio Vargas. Remember Huggy Bear? People don't know him. He's an actor. He was the black man in Starsky and Hutch. Now I guess that's vintage TV. He told an amazing story at an event that the Black AIDS Institute has partnered with for 12 years. We call it the Mississippi of the West. That's Nevada. Las Vegas. Kemet in the desert. Kemet in the desert goes for a month. Antonio Vargas spoke. He said, I took the role of Huggy Bear because I had a brother who was gay. My father came home and caught me in the house with a girl. Man, get up out of here. Get that girl up out of here before your mother come home. His father came home and caught the brother in the home with a guy and almost kill him. It's the realities. So who can remove that shiny layer of this onion? Black women again. Because you cannot call your sons out of their names. You should not attend a church that's homophobic and tithe. Because the God you serve loves everyone. And if not, that's not God. Buddha, Allah, Jehovah, whatever you call it. So we have to drive that. Because our young men also love God. So where do they go? In the denominations and the religiosity versus the spirituality of the Black church. And the only person that can hold the Black church accountable are Black women. Because if we had a day of absence, the Black church will collapse without Black women. So I'm striving to get Black women to see we are essential. We are the hub of wellness in our community, not just for cancer and diabetes, but for HIV, STIs, intimate partner violence, schizophrenia, depression. And these all flow in. So lastly, I would say in terms of PrEP, and here's the deal. You should not be going to a healthcare provider, primary care, OBGYN. So your OBGYN or your primary care, that same doctor you go to when you get the flu. If she or he does not speak to you about your sexual health, it is not a good doctor. Founder of the Black AIDS Institute now 14 years ago, I said, hey, they're giving out a lot of this PrEP to the rich women. It's impossible. Well, guess what? The second largest group in Mecklenburg County being prescribed as PrEP were white women, married white women in affluent zip codes. Why? Because they were speaking truth to themselves and they loved themselves. And swinging. We don't talk about swinging. I grew up in New York where the hippest thing, they're the baths, the baths, Plato's Retreat, some of the biggest kind of open sex things were happening, right? New York, San Francisco, places like that. Today now, we know we have sex parties everywhere. I know phlebotomists who are hired to attend sex parties. Are we speaking openly about that? The youngs, I call them the youngs. Who are the youngs? Anyone under 35. The youngs speak openly and freely to us. And the youngs tell us how they conduct themselves at their parties, right? Their sex parties. No judgment. The old heads are doing that. Old heads are not requiring status. Old heads don't provide on-site status, testings or screenings. You hearing me? Someone reported going to a sex party and didn't see condoms. Now let's get to that. We're talking about PrEP. We're talking about the oops pill. That's the post. What is that? You've had unprotected sex. You're concerned. You can go to your doctor and take a pill for the day after and be screened for 6 to 8, 10 months after to determine your status. So there are biomedical interventions that can prevent you from contracting the virus. And we never speak about the pre or post to women specifically. We never do. And, speak to pharmacists. The most crushing thing is to receive a call from a pharmacist who says, hey, there's a young woman here, she's employed, she has insurance, but her copay on her new ARC, on her new drug, because she's recently diagnosed, is $2,200. That's where we have affordability issues. Lastly, if we were vigilant in the biomedical interventions and in the marketing of these drugs, we would have demanded that they not remove the condom as an essential tool of wellness. We would have demanded it. If Black women were at the table in a way that we fully understood the outcomes, we would have demanded it. Okay, don't keep telling me people don't like condoms. PrEP only prevents what? HIV, not gonorrhea, not syphilis, not monkeypox. and not the new pangos that they don't even define yet by a name. All they're doing is calling them 5-107. And in Mecklenburg County, we have some of the highest syphilis rates. And at a time when we had great leadership in healthcare and the public health model started noticing, I went next and said, why do people have to give a blood draw to have an HIV test in Mecklenburg County? This is a decade and a half ago. Well, the reason was that there was no funding for the syphilis. So in order to check for the syphilis, you would draw the blood. It was innovative, but it was also a deterrent. And today, they have strands of syphilis that are a public health crisis. They're resistant to meds. Do Black women know that? Right. And have we, who have raised our young sons and our daughters, have we informed them about these things as when the young people are getting ready to go to college? All the girls, I think, are taking to get birth control pills or what? A LARC, a reversing contraceptive in their arm. But are we speaking to them about something that could be much more life-threatening than pregnancy? So we have work to do. And that work is to reintroduce HIV to the community at large and reintroduce HIV as essential education to Black women, 8 to 80.
That's a perfect segue to start winding down. You literally answered all the questions I had. And I have even more questions, trying to figure out where do we go from here? As Black AIDS Institute, where do we go from here? What do we do in terms of HIV prevention? Literally, yes, for Black women, but obviously this is an intersectionality issue. This is an issue that transcends beyond race, socioeconomic status, as you said. What do we do now?
As the mother, as the architect of intersectionality, Dr. Kim Crenshaw, a friend and colleague, would say, we take all those component parts and put them in that hub, right? Put them in that cross. And what do you actually have? We at the BAI, in our reimagining since 2021, and as we celebrate 25 years, have coined that we are revolutionizing HIV prevention and care in a uniquely and unapologetically Black way by returning culturally to a multicultural message. We will sterilize stigma intergenerationally. And we will radically partner with the subsets of Black community. What is a subset? A subset is like the house kiki ballroom community. If you watch Pose, if you watch, Legendary, that is a subset of our community that James Baldwin wrote about. We celebrate a 100-year anniversary of Baldwin. He wrote about it. It was called the Negro Scene. He wrote about beautiful Black men who dressed as women. We will reclaim that as culture. Why are we struggling so much as the transgender man and the transgender woman? Why? If people just would go back and look at the women in Brewster Place, Black women have always had a relationship with trans. Then they weren't even called trans. It was transsexuals, transvestites. The name seemed so much harsher. And those men were and are elegant. And those men were our friends. And those men would be our babysitters and our mother's shelter from storms of domestic violence, of not being able to meet and pay the rent. As friends, as girlfriends, as uncles. And we've forgotten that because we're not pushing the grapevine. And what do I mean by the grapevine? Think of a bunch of grapes. Have you ever seen one grape on a platter and want to grab that one grape? It's the one left behind, right? It's just one little grape. Do you want to eat that? Black people must remember we're the bunch. And as the bunch, we are just beautiful. We are a plethora. We are bountiful. We're resilient. We're informed. And today we are segmented. So at BAI, we're returning back to the cornerstone of culture. We will be revolutionizing how HIV occurs. And why is it revolutionary? Because if funding remains the same, it's political. Even in pharma, where do they go? Where the numbers go. Oh, it's young MSM? Well, all the funding's young MSM. Oh, it's trans? All the funding. No, for Black people, it must all be together. Because I submit to you, before you knew you were gay, before you knew you were trans, you cannot unzip this Black skin. So once we all get in it together, then we can go to our subsets. But all together, we are in this together. And every person that's on this planet has a mother and a father, or had a mother and a father, and had someone to care for them. And so the women in the race must lead the way. Bring condoms back.
What a way to summarize and end this. But before I let you go, I do want to find out from you, cause of action. How can our listeners who want to make a difference, what steps can they take to support, your efforts at BAI, and how to get involved in the community?
Multiple ways. One, know your status. We have at-home kits. You can go to your physician, but know your status. Encourage everyone you know. Just like we have breast cancer buddies, we go for the walk. Know your status. Commit to that on your birthday, like your checkup. Know your status and know the facts. So when the next time a person says, girl, you can't go to her house, I think her son has HIV. Don't use the toilet. Don't let her drink behind you. Know the facts. Eradicate myths. Do not allow people to spread them. If you'd like to support BAI, blackaids.org. Donate. If you're a federal employee, look for us in the federal campaign. And I'll say to you, we're 25 years old. $25, 25 cents, $2.50. If every Black person committed to BAI or their other HIV organization of choice that is genuinely focused on eradicating or really bending, right? We shouldn't say eradicate, but we could get to a sum zero where that number is flat. Understand the government policies around it. 2030. Join us at 2030. That is for Black women at BAI. 2030, the government has put a stake in the ground. But they say by then they want to have success in HIV. White gay men have reached that number. We haven't. Will we make it? I think we're going to fail if we don't galvanize. Now, are we gargantuan? Yes, we can do this all together. So learn the policies. HIV is the only disease required for the United States budget to be balanced. And people want our money. People want the money for HIV. And if HIV today in its stats is Black, we need you to know we must rally for our money, reauthorize, fund HIV as anything else, right? So whether whoever's in the White House, demand that. And then lastly, know that PrEP exists. However, PrEP is not a silver bullet. So if you want to have safe sex, have it when, long as you want, how you want, safely, and the barrier must become sexy again. And the barrier, condoms, must become sexy again. Thank you so much for your time. And HIV should become part of the conversation as we talk about finances, religion, work, education. HIV should be part of the conversation in the Black community on a daily basis because it is grossly, disproportionately impacting our community.
Wow. I have nothing else to add. Just to say thank you so much for joining us today for this impactful, insightful conversation, Grazelle Howard. And I'm definitely looking forward to inviting you again because there's still so much more to talk about. You know, Our youngins think HIV is not a big deal. You know, we have antiretroviral medication and we've managed to mitigate stigma to a certain extent, but we need to continue harping and talking about HIV as everybody's business. And you've told us today that everybody is at risk for HIV.
Absolutely.
And we concur that PrEP and PEP are great inventions, but that's not all. It's not the magic bullet. We need to advocate for all the policies, finances. It's a whole thing. It's a whole shebang with HIV prevention. And I'm really grateful that you are able to join us today. So it's your turn, my listeners and viewers, to take action. Visit the Black AIDS Institute website to learn how you can support their initiatives, whether through volunteering, donating, or just spreading the word, like Grazelle told us. And if you found this episode valuable, share it with your friends and family to raise awareness about HIV prevention. And also don't forget to subscribe to Public Health Musings for more inspiring discussions. Remember, together we can make a difference in public health and help end the HIV epidemic. So until next time, stay engaged and proactive in your community, everybody. Thanks again. Until next time. And thank you, Grazelle.